That we're asked very commonly about how to deal with lumps and bumps around the eyelids after tear trough filler injections. These can be quite common. They're in fact fairly universal initially after applying the filler. But the tear trough filler itself can be quite unpredictable in terms of how much fluid it can absorb. And patients will often have a small degree of irregularity. And what we see here is just a very small little lump here. Depending on what filler is used, massage can be applied to disperse the filler. We use the very modern licensed varieties, and massage can be extremely helpful. But it can be really difficult to know how to do the massaging. People will often give very gentle massage, but it's not enough to disperse the filler, and it needs to be quite firm. And so what we're going to do here today is just demonstrate how to massage this filler away. The important thing is that it needs to be massaged usually in an outward direction, depending on where it is. And so if it's from the outer part of the eye, we want to massage in this direction, and on the inner part we would massage in a downward direction towards the nose. And it's really critical that a rolling movement is used and it's pressed against the bone. So I'm going to start with my finger over here and pressing very firmly and rolling in an outward direction. And again very firmly in an outward direction against the bone. And that is quite firm, isn't it? Yeah, okay. And it does feel quite firm, but it's important to show the patient how to do that. And again, look upwards for me again. And again, I'm just going to be dispersing. That's dispersing really, really well. It's important not to do too much of that because it will disperse all of the filler away. So I'm going to ask the patient to do that at home a little bit if they feel that there's still a bit of fullness there, but that usually really helps deal with any irregularities. And so there you have it, how to massage tear trough filler if it's causing any swelling or lumpiness.